We have another viewer question. Our viewer writes, "Dear doctor, are there any techniques that you know of that will make blood collection easier for MLAs?" Well, that's actually a really good question. It's a really complicated question to ask. In fact, that's why we've been doing these lectures for years, and usually we spend an hour on any one part. But we'll try and give you some quick ideas. The first one is about positioning. You've got to put yourself in an ergonomic position so that you don't hurt your back. So make sure that the patient is adequately elevated up for you, or if you can sit on a stool sometimes, just make sure that you're in a comfortable position. Next is to make sure the patient's position is correct. So most importantly, what you want to make sure is that the hand and the arm are below the level of the heart. That will cause the veins to distend a little bit, which makes them much easier to find, and an easier to find vein means a much higher success rate. The next thing is lighting. You want good, ambient, natural colored lighting wherever possible. In an outpatient setting, this usually isn't a problem. Where we see this as a problem, though, are inpatients. So when you go into the room, even at nighttime, you need to make sure you turn on those lights in order to get as good a view as possible. That will increase your chances of getting the poke right the first time. The next thing is to put the patient at ease. Small talk is your friend. You want to distract people. Most people don't really enjoy the process of having their blood drawn. Talk about the weather, talk about something interesting to them, just talk about anything. It's better than standing there silently. It allows the patient to talk about something and focus on something besides the impending blood work. Next thing is to smile. I know it sounds kind of odd, but when you're looking at a difficult to get at vein, quite often when you're looking at it, you'll be sort of frowning at it and you come back and you've still got a frown on your face. Well, that's not very reassuring to a patient. So make sure you smile after you find a nice vein. And similarly, you might want to say something like, "That's a great vein." Reassure the patient that you're going to get this on the first try. The next thing is a bit of psychology. You want to avoid words like pinch or poke or any pain words. We know that using softer words from a German study actually makes patients feel less pain. So you can say something like, "Here we go," or "Take a deep breath just before you start the phlebotomy." Once you've done the phlebotomy, there are some things that can also help. We all know you need to apply pressure to the wound after the needle is taken out. And in fact, the pressure is one of the biggest things we can do to decrease the amount of bruising. When you go back to do a phlebotomy the second time, going through a bruise hurts a lot more. So if you can avoid the bruise in the first place, it will make your subsequent ones easier. What that may mean, though, is that for many patients, you're going to have to apply the pressure because many patients do not apply enough pressure, particularly older patients. So for those patients, you may need to apply pressure yourself. Similarly related to that is the tape that you put on there. It does not need to stay on for very long. It only needs about 15 minutes. By that time, you're long gone. But what you can do is remind the nurses that for phlebotomy, that tape does not need to stay on very long. And so they should remove it within that shift. Otherwise, the skin and the tape start to merge into one. And when you go to remove that tape the next time, you're going to be ripping off a little bit of skin, which already makes it tender, and that's going to make the subsequent phlebotomies in that area much more difficult. Similarly, if you have a patient with very fragile skin, what you can do is either take tape that's specially designed for fragile skin, the blue tape in most institutions, or if you don't have that, you can take your regular piece of tape, apply it to the bed linen, which gets a little bit of fluff onto the tape itself, and then put it on. With that little bit less tack, it'll come off a whole lot easier. And similarly, you can also create a little tab by folding the tape back onto itself, and it gives an easy spot to lift that tape off rather than having to pick at the skin. And finally, you want to make sure that you adequately fill the tubes. Sure, at the time, that's a little bit inconvenient, it's a little bit longer needle in the patient, but if you can reduce recollections, well, that's one less collection that you need to do during the day, and for the patient, it's one less poke. And so for subsequent ones, it's easier the fewer pokes the patient has. So hopefully in the last couple of minutes we've gone through a few tips which will hopefully make your job a little bit easier and a little bit more enjoyable for the patient. Thank you.